I have often been called the matchmaker because as a transplant clinical nurse specialist, my job is to bring patients needing a kidney and donors together. It's 1978, evening shift in the ICU in a hospital in North Philadelphia. My patient arrives from the recovery room, just had a kidney transplant. The surgical resident pulls up a chair next to the bed where the Foley bag is attached and stares. The bag is filling, the resident's eyes are glowing, and he says, "Isn't that the most beautiful sight?" It's 1983. A donated kidney sits in the cooler in my otherwise sparse refrigerator. I'm now covering the Metro Philadelphia area for Kidney One. I've arranged for heart, liver, kidney, tissue, and bone recovery teams to come to any number of hospitals. A typical procurement call spans 36 hours from the initial family conversation, managing the patient in the ICU, preservation and perfusion of the organs in the operating room, and finally placing the kidneys from my apartment. Airline schedule books are strewn around the living room. How much time do I have to make the flight? Am I out of time? Is it time to send the kidney to England, Poland, Kuwait? Finally, the courier picks up the kidney. I crawl into bed. As I lie there, I think, I need a husband. I have no coffee, no toilet paper, no milk, no food in the fridge, only coolers. It's been exciting, of course, flying in a helicopter to Midtown Manhattan. We've flown on Learjets with all the fancy amenities that we can't enjoy, sat in the rear seat of a plane feeling ill while we flew through a violent thunderstorm, and I've ridden in more ambulances than I can count. I'm on call. We take a helicopter to a hospital in New Jersey. A 19-year-old boy's mom has agreed to donate his heart. His mom told me her son's heart was so good and she wanted someone else to have it. In the recipient operating room where the transplant was taking place, I asked the circulating nurse if the patient's diseased heart had been removed yet. It's on the back table. It is? All I could see looked like a blob of chocolate pudding. That was a heart. The transplant surgeon had my donor's heart in his hands now. The contrast was unbelievable. The sight of that beautiful, young, healthy heart is an indelible memory for me. It's 1985. After 3 years, I realize my emotions have a limit. I can speak with 3 families a week, no more. It's too hard to see the sadness. But is it? How can I describe the immense admiration I have for these families? They've yelled at me, cried with me, pleaded with me to stay with their child in the operating room through the surgery. They are so strong. I am so weak. Donors are the essence of humanity. They are my teachers. They are all I hope to be. And being a transplant nurse, I've loved it and hated it, and I can't give it up.